Work and on BBC Sounds.
11:37 here on The Big Debate. Good morning, everyone. My name is Casa Alom. So, excuse me, a big part of plans to tackle the coronavirus outbreak has been testing. Excuse me. Now, lots of controversy around that, with some saying the government's been too slow in rolling out tests to check whether frontline workers have the virus. But what about antibody tests? They look at whether you've had the virus and therefore have the antibodies to fight it. Now, frontline workers we've spoken to, like pharmacists, say they're keen to be tested just for peace of mind. And I bet they're not the only people. And there are tests available to buy. The problem is that none of them have yet been approved by the UK government yet. The government say that some of these tests would give people a false sense of security. And I want to know what you think about all of this. 03459 440 445. Give me a call or text 81869. Do you understand why pharmacists who are dealing with people every single day might want the option of knowing if they're immune to coronavirus or not? Get in touch. Maybe you're a pharmacist out there who's actually used an antibody test or know someone who has already. WhatsApp me 07920 500 200. Is that something that you would like to have? Or can you understand why people are a little bit reserved about them? Because if they've not been approved by the government, well, then they could give people a false sense of security thinking, oh, I'm immune or I've got the antibodies, I'll be fine. And then they could get coronavirus and infect others as well in the future. Let me know your thoughts. As always, give me a ring 03459 440 445. So there's loads here, isn't there, to clear up. Let's speak to Priya Rai then, who's been looking into it all. Priya.
Good morning, Casa. Let's just repeat, first of all, this is not a test about whether you have coronavirus now. It's about whether you've had it. So, as you say, it's whether you carry the antibodies needed to fight the virus off. They work by looking for signs of immunity by using a drop of blood on a device that works a bit like a pregnancy test. Now, if you get a positive result, it means that you have had coronavirus and in theory, your immune system's built up the defence against that strain if you contract it again. That means for pharmacy staff and healthcare workers in particular, they can go to work and be exposed to people with the virus with the knowledge that they're less at risk themselves. The government says none of the tests that it's looked at are good enough in terms of accuracy, but some are being made and sold to pharmacies desperate to protect their staff, although they're not given to them for them to sell on to the public. It's just for use by their staff. We'll speak to one of the suppliers in a moment, Pharmadoctor. They've privately supplied over 30,000 of these antibody test kits to UK pharmacies. Pharmaplex is one of them. Jag Babra is one of their management team, and he explained to me why they were so keen to buy.
The need to kind of have our staff tested. This was right at the beginning of the outbreak. So we needed to get our staff tested, one, for peace of mind, to make sure they didn't feel exposed and didn't know how, whether they were carrying symptoms and being spreaders or super spreaders at the time.
Have you got that peace of mind?
The staff are definitely less on edge. The fact our staff know where they stand is causing a lot less stress than the ambiguity was prior to this, because before there was a lot of press going about you could be a silent carrier. There were people who were worried whether they'd be bringing it home to their families. Additionally, there was the duty of care they had for their patients.
Do you think there's any element of risk, or do your workers think there's any element of risk? Because obviously these tests, they're not yet validated by the government and they don't have 100% accuracy rate. So there could be a chance of a false result.
We can only control what we can control. If this is what we have available to us, it's better to have that information rather than not. We've been assured that this is the best that we can have available.
And do you think it's right that you've had to pay for a test that you have bought to help protect frontline workers, essentially?
Our supplier are great. They didn't charge us a lot. I believe they charged us cost, if that. The moral obligation wasn't that we were entitled to it. The moral obligation was, what could we do for our community?
Now, Casa, he says he bought 30 tests for £75 and the supplier says that it's not making a profit and that is actually cost price.
Priya, I bet there's going to be a lot of people who think 30 tests for £75, I would mind that. I would quite like that myself, actually. I fancy that. So if you are out there, if it was available to the general public use, would you go out and get one? Would you want an antibody test to see if you have already had coronavirus or not? Get in touch, let me know your thoughts. 03459 440 445 or text 81869. Equally, I want to hear from you if you're someone who thinks, well, look, if the government say they're not approved yet, if they're waiting to see if they're effective in that way, I don't want one. I don't want to have that false sense of security because it could cause more problems further down the line. So if you're one of those waiting for these tests to get government approval before you use one, get in touch and let me know as well. WhatsApp 07920 500 200. So Priya, yeah, I've mentioned the government a little bit. It's something that we talked about before. Where do they stand on antibody testing then?
Well, the government says that 15 of the most promising antibody tests that have been tested, none are good enough, essentially. And
including
the World
this
Health
one, then?
So it's quite difficult because they say that it's moving at such a fast pace they can't actually give a list of the specific products that it's testing, but that it is testing essentially. The World Health Organization says there's also no evidence that tests can show an individual is immune or protected against reinfection, and that comes down to what we know and don't know about the virus itself. So lots of grey areas, and with new viruses like COVID-19, the body doesn't naturally have antibodies. It doesn't naturally have immunity. But if you become infected, then your body is in theory able to develop the antibodies that it needs to fight the virus off. Antibody tests help in identifying people who can potentially go back to work. So, as you said, you can understand why they are desirable, why they're part of the government's plan at some point. Now, suppliers and pharmaceutical companies say there are tests which have been approved for use and sale within the European Union, but crucially, these have yet to be approved by the UK government. The government and its scientists say an unreliable test is worse than no test. And the chief medical officer says organisations should really not be buying their own unvalidated antibody tests. But we also know that the government is working with several companies, as I said, testing what's out there. On this specific test that Jags Pharmacy has bought, which comes to what you just asked, it's made by a manufacturer in Belfast. They're called Biopanda Reagents, and they say they have submitted information about it to the government, but they haven't heard back. And as I said, the government says they can't provide a list of all the products that it's testing. Pharmacies who buy these tests are not breaking the law, but these tests do come with a warning that they can give a false result, which of course means a risk. The question, Casa, is how big is that risk and should it be taken?
Okay, over to you, listeners. Is that risk big enough for you? Would you take it if you had the chance to take one of these antibody tests? Would you? It's as simple as that, really. 03459 440 445. Do you think, even though they're not government approved, that you would take one of these tests? Is it a good idea? Or do you think, no, I want to wait for approval because, as they themselves have just said, it's not a guarantee that they're going to be giving you a conclusive result. They could give you a false result, which lulls you into a false sense of security. 81869, let me know your thoughts. So lots of questions raised there by Priya. Thank you for bringing that. Let's see if we can answer some with Joaquim Pereira from Pharmadoctor, who supply around 12,000 pharmacists in the UK. Priya was talking a little bit about them. And then after that, we're going to speak to Ravi Sharma, the Director for England at the Royal Pharmaceutical Society, who do not support these antibody tests being used at all. We're going to do both of these interviews separately. Joaquim first. So, the tests that you are selling, how confident are you that they're not going to give a false result here? Hello, Joaquim? Okay, so we're going to go to Ravi first of all then on this. Ravi, we seem to have lost Joaquim, so let's talk to you first. Why don't you support these being sold at all, or anybody using these tests in Pharmacists?
Hi, good morning. Thanks for having me. We know that people are worried about their health at the current moment in time with this global crisis, and everyone wants a solution to help understand if we've had the virus or not. But regardless of, and actually hearing from what you both were talking about this morning, we have to rely on the science and be guided by it. It is really important to say that no antibody test has currently met government criteria for accuracy or reliability, and that's currently available at the moment in time. And there's great global effort with various research organizations to develop a good antibody test, but it's not quite here yet. And there's a number of reasons for that. Firstly, we don't know enough about the virus. We're finding out new things about the virus all the time. We also need to gather further evidence on the body's immune response to the virus. It may actually mean that we don't actually have a long-lasting immunity, or we are susceptible to not actually having any immunity at all once we have the coronavirus. Also, the fact that some of these antibody tests are not specific to the COVID-19 antibody either. And as you both rightfully mentioned, there is a risk of false positive or false negative results. And the worst thing any of us would want to do at the moment is actually go to work, pass on this infection to one of our work colleagues, who then go back home and pass them over to their family members. We know this can have a devastating effect on the people's lives, and that's some of the reasons why we don't support them at the current moment. But we know with the clinical trials that are happening with the government and across the world, there could be some opportunities to find out more information about the virus, but also to help develop more accurate and reliable testing.
Okay, so that's your stance on this. Going to speak to you in a couple of minutes' time, but I'm going to go now back to Joaquim here on the programme from Pharmadoctor, who supply around 12,000 pharmacists in the UK. I think we've got you back now. We had technical difficulties, didn't we? So, yeah, my question to you was, how confident are you that these tests are not going to produce a false result here, Joaquim?
Well, the positive result is very accurate. We're looking at a accuracy of 98.6% on the IgG marker, and the actual government's own requirements for that for the test is running at 98%. So it meets those requirements. Whether it will meet those requirements after fuller, stringent evaluations is another thing, but it's there or thereabouts, definitely.
And how many people have been tested with this to get that result?
So those results were done on 60 serum tests.
Well, there we go. 60. Is that a large enough sample size to ascertain that actually we have such a high...
It's a large enough sample size to actually release a product, and that would be normal standard procedure for products to be released and self-certified. I would expect that the government wants to do more evaluations to actually be certain when buying that many tests and doing such a large national program. Of course, they want to be absolutely certain, and that's the proper and right thing to do.
Mm-hmm. So, if that is the proper and right thing to do, why are you selling them?
Why? Because why are we selling these tests? Well, they meet all the requirements that are required of the government. It's legal for us to sell them.
They haven't yet approved them, though, have they?
Yes, but they haven't approved anything yet, and we don't even know if they've actually evaluated this test.
Exactly. So if they haven't been evaluated, so sorry to jump in here, but if they haven't been evaluated, if you haven't got the approval, like so many others, and if we've heard the chief medical officers and so on saying that that they could be producing false results, why are you ignoring all that and still putting them out there anyway for people?
It's highly unlikely that they'll produce false results. The tests have been tested already, and they have passed all the tests that are required of it, and they have been approved for sale to healthcare professionals.
Have they been approved by the government, though?
They've been approved by the Medicines Healthcare Regulatory Authority.
But have they been approved by the government of this country who are trying
for their own use? No. As in for the government's own use and their own program, no, they haven't been approved, but they haven't approved any test.
Okay, well, I don't understand why not having anything approved is a reason to go out and sell these.
But these tests are just like all other tests that have been on the market for any other virus over the years. These use the same technology. These tests are for other viruses, strep A, HIV. They have been on the market for years and used and approved in the same way that this test has been approved. By the same argument, you would then say, let's take all tests off the market unless a government body has gone off and evaluated it.
And how have you come to this? You yourself have admitted, loads of people have said that this is a very, very new virus. We don't know the limitations of it. We don't know if people can be reinfected or not. There simply isn't enough research around this. So therefore, comparing it to other established viruses actually doesn't work because we don't know the full consequences of this virus, do we not, Joachim?
That is true, but we can only work with what we have. So your options by that regard.
Well, people in the 1800s
nothing.
thought that mercury was a good, was a good way of dealing with, inhaling or swallowing mercury was a good way, and they did that based on the evidence that they had then. That clearly in the past has been proven to be completely the wrong thing to do as a poison. That's not a reason. It's not a valid reason.
We're not talking about a treatment. We're not selling a treatment for coronavirus. We're selling a way of testing for coronavirus. And testing is quite an exact science. These tests are testing for both the N and the S protein within the coronavirus. The S protein is the one protein that has been identified by the government that is what they want to lock onto. The tests themselves provide a very accurate reading of 98.6% from the tests that we've done, which is not saying let's treat these patients with some sort of random treatment that hasn't been tested. It's just an identification of whether they have built an antibody, and the science on that is quite exact. It's not something that is going to be needs a huge amount of testing in the field like a new treatment.
Okay, I understand what you're saying there. A couple of questions on that. How do you substantiate whether something is 98.6% or not? Where did the other 1.4% go?
Because I'm not the manufacturer, I'm just the distributor, I would have to pass those sort of questions directly. That's a bit more into the technical detail than I would have.
Okay, fine. And then these statistics that you're talking about, right? The government's own criteria means that the specimens collected must be for at least 6 months before the known appearance of the virus, or have at least 200 confirmed negative cases. You don't have that, do you?
No, but no one has that.
Well, until someone has that, they shouldn't be out there to be sold, should they, to pharmacists?
You're going by that same argument, then essentially the legal requirements for a test to be legal to sell is not what the government's evaluation requirements are. So by your argument, then all tests, possibly even many pregnancy tests that are on the market, should not be sold because they haven't been evaluated by the government and they haven't reached those high, lofty bars that the government is setting on them.
Also, on this, thank you for sharing your thoughts on this, Joachim. If frontline healthcare workers do have symptoms, well, we heard from Matt Hancock last week, they can themselves get a test to see if they have coronavirus now. So why do they need access to a test that says they've had it in the past?
Well, so first of all, these are PCR tests. They're antigen tests. They test whether you have the virus on you. Now, these tests are actually they're not 100% foolproof. You could swab incorrectly. The patient or the person that's being tested might not produce enough saliva. So there's actually a higher failure rate on these tests than on the antibody tests. Secondly, if you present too late, then you will not have the virus in you anymore. If you present too early, you haven't built up enough saliva to actually be able to swab. So the actual window to test is smaller. At the same time, during that window, the patient's going to be ill. So they're going to have to drive. And I hear that there's 33 testing centres around the country. So in some places, or if you live in a remote area, you'll have to drive 70 miles to the closest test centre. That's taking a lot of time off your day. So essentially, the tests are not perfect. What if you had the virus 3 weeks ago, and now pharmacists are able to be tested now? Well, that test won't show. So again, if you had symptoms a few weeks ago, and you want to find out if that was actually COVID-19, you'd use the antibody test, the blood prick test, to find out.
Okay.
And at the moment, these are the only things that are available to give any pharmacist that peace of mind.
What's the benefit of selling this test then? Why do pharmacists want it?
Well, they're exposing themselves often to vulnerable people who are having to pick up their medicines. They have patients and customers that they want to protect as well. But they're being exposed themselves on a daily basis. They're one of the few services that is having to operate and having to provide a full service. I've walked into pharmacies during this time and seen that they've been quite stressed by it, and they've had
so why is it then that they want this?
Well, it gives them a peace of mind. It gives them knowledge that they might have had it, if they've tested positive, that they have had it. It gives them a certain knowledge that, okay, I've recovered. If it wasn't that bad, I may well be immune. The likelihood is that I am most probably immune. I won't be able to then give it to my patients, or at least that I can run my service now with that knowledge and be safe to my patients, the rest of my work cohort. A pharmacy owner will be able to know if a certain amount of percentage of patients of their staff have that virus, and be able to put those key workers in certain positions depending on their status, their immunity status.
Which would be good. You're right, Joachim. It would be good if we knew that this wasn't a virus that we could get again. And we don't know that.
But they're going to.
But we don't know that, do we? So it's about. Is it just about giving peace of mind? Because if people have had it in the past and they know that, well, that's not a guarantee that they're not going to be able to get it again, because we haven't proven that one way or the other.
We're talking about frontline workers that have to put themselves at jeopardy. There's no option for them.
Can you answer my question though, very simply, Joachim? Okay.
Yeah.
Is there a guarantee that if you've had it in the past that you're not going to be able to get it again?
There's no guarantee that.
So then, what is the purpose of this test?
The likelihood is that they won't. It is more likely that they won't. Now, with that said, it is the closest and the only thing that anyone that is a frontline worker might have as any form of knowledge or courage that can keep them putting themselves at the front line and at risks.
Okay, Joachim, thank you very much. Joachim Pereira there from Pharmadoctor, who supply around 12,000 pharmacists in the UK. Listening to that, is that enough for you? Is that enough for you? Would you want an antibody test on that? Has Joachim Pereira reassured you there, or is it still something that you would want to wait for government approval? Let me know. 03459 440 445. Right, let's go back to Ravi Sharma then, the Director for England at the Royal Pharmaceutical Society. What do you make of what Joachim was saying there? Was that reassurance for you enough? Was it worth it?
As I mentioned earlier, I think it's really important to say that there is no antibody test that has yet met government criteria for accuracy or reliability at the current moment in time, for many of the reasons I mentioned earlier. So we don't know enough about the virus. We don't know about an individual's immune response to the virus. And we're looking in the news at the moment around people of different ages, people of different ethnic backgrounds, and the evidence and data around those people's responses to their immunity is still very much up in the air at the moment. And as I mentioned earlier, some of these tests aren't specific to detect the COVID-19 antibody, and with the risk of false positive or false negative results, there is the potential risk of transmission of COVID happening amongst key workers, but also taking it back to your homes and spreading them to your families.
Well, their tests show that the false positive result, the likelihood is about 1.4%.
that doesn't mean it's 100% accurate either.
But nothing is 100% though, including the government's own drive-through tests for not for antibodies but for coronavirus. None of it is 100% certain. Not even a pregnancy test is, though, is it?
So I think what we're trying to get to here is that we understand people are worried about their healthcare. This is a really tricky time. We need to be assured that the accuracy and reliability of these tests are of the highest and most stringent level. As you mentioned, no antibody testing has met the government criteria. And if we look at the government criteria, there's lots of things that need to be met beyond the percentage accuracy, which is a really important part. There's a number of different aspects that need to be met. What's really important, that these are done in safe environments, clinical trials are done appropriately, the evidence and information around people's immune response is happening, and those are coupled together with the reliability and accuracy of these results to give a better picture of what this means.
So are you saying these tests aren't reliable?
The antibody tests at the current moment, in their current way and way they've been shaped, are not accurate or reliable at the current moment of time. And hence, there is massive global efforts currently happening. You would have heard the Chief Medical Officer, Chief Scientific Officer saying they're working with a number of different providers, research organisations across the globe, even some here within the UK, to try and get that accuracy. And it's really important that we strive for this. What would be not right is to produce an antibody test that isn't reliable and accurate, creates anxiety within the communities of the members of the public within our key NHS workforce.
But how is that creating anxiety, Ravi, when the anxiety is already there? I've spoken to pharmacists on this programme, people who are saying that they've had to install perspex glasses themselves to try and keep protected. The anxiety is already there, and it's mounting because, in their eyes, not enough is being done to protect them quickly enough.
So we are completely with you. At the Royal Pharmaceutical Society, we have been lobbying a lot for protecting our frontline workers, particularly pharmacists and their support teams. It's important that people follow government advice around hand washing, social distancing, and wearing personal protective equipment during.
But what about testing? Testing is also very important. You haven't mentioned testing there. Is testing not a priority?
Yes, and government, and due to the work that we've been doing, government has now increased the access to testing from an antigen testing perspective, where pharmacists and their support teams will be able to go onto the government portal, be able to register for a test, and not only get drive-through tests, they will also be able to access home delivery tests where people will come and give the test for them and their family.
And we've seen that those have also not been 100% positive as well in their accuracy. So again, what is the difference here between what's been approved by the government and what others are doing, which have the similar levels of results?
I think what we're going to is antibody testing suggests that you have a release-based immunity for coronavirus. And we know there are lots of different antibody tests that are out there. So if we take normal viruses, for instance, that have been around for many years, once you get it, you generally feel unwell. That's your body's immune response. You produce antibodies that help your body to fight it if it comes into contact with it again. We've talked about coronavirus being really new. It's taken the globe by storm. And we're all trying to work together to try and contain it, to try and manage it a lot more effectively. I think within this very sensitive environment, we need to ensure that the testing that's being produced to the market are being tested on our frontline, hard-working key NHS workers and key staff, but also the public, is safe and accurate. And as I mentioned earlier, we still need evidence and data to look at people's immune response, whether we actually have complete immunity from coronavirus once we get it. The World Health Organization said this weekend that there's no evidence that recovery prevents a second infection. Okay. So is there a need for an antibody test at the moment, unless it's really accurate and reliable and we understand what coronavirus is doing within the body and how it builds our immune response?
Mr. Sharma, you're saying there that everybody is trying to work on this together, but then we've had numerous reports, and we've had Joe Queen here himself say, and others in other fields are saying, that the government is simply not getting back to them when they are offering their help, or when there are ideas that they are putting forward, ways to collaborate. They're just not hearing back. There's no response there. How is that working together?
I can't unfortunately comment on where the government works as well, but I do know that from the information that we have already available to us in the public domain, that government are working with various organisations across the globe, research organisations, providers of data analytical testing of these type of tests as well, to try and produce an accurate and reliable picture that we can help the public around the testing strategy from the UK perspective. I unfortunately can't comment on the way the government's working collaboratively, but what's in the public domain, I think there is lots of work in a very changing, fluid environment, that there is work currently happening to try and produce an accurate and reliable testing strategy that ensures that people are well protected on the front line, from key workers, but also to those that are currently affected with coronavirus as well.
Okay, thank you for your time there. That was Ravi Sharma there, who was just speaking there, Director for England at the Royal Pharmaceutical Society. And before that, we had Joaquin Pereira from Pharmadoctor, supply around 12,000 pharmacists in the UK. We also spoke to our reporter Priya Rai. What are your thoughts then? Do you think, would you take one of these antibody tests? There's a lot of, a lot of confusion around whether they are completely reliable or not, or whether they're approved or not. Does that matter to you? Do you think that there are too many of these tests out there, that there's not enough information around? Get in touch. Let me know your thoughts. 03459 440 445. It's 7 minutes past 12.
Got the sun and the sand and the sea and the night, and we're feeling alright. Yeah, we're feeling alright.